New at 6, the danger of going under the knife across the border. A Phoenix family is mourning after a 25-year-old woman died in Nogales, Sonora, in a Nogales, Sonora hospital known for performing cosmetic surgeries. Being so close to the Mexico border, a lot of people from the valley take part in medical tourism, hoping for lower prices. Team 12's Monica Garcia is here with what to look out for before you make the decision to go under the knife. Monica?
Kariba, I spoke with the receptionist at the clinic where this woman died, one of the last people to see her alive. She tells me the clinic is not responsible for the death because the operation room was rented out that day to a doctor who is not a regular employee to this clinic. That right there, a big red flag, according to a Phoenix plastic surgeon I spoke to.
I get about 20% of my patients come from having surgery in Mexico.
Board-certified plastic surgeon Dr. Ramon Robles saying he helps correct botched liposuction and tummy tucks after patients have crossed the border back into the U.S. and are in intense pain.
She came in because the wound, the whole wound was still open. And probably the one that I've seen the worst, and I wish that I could pull up his picture, is just a young man that had fillers injected in his face. His eyes were completely shut. His face, it was just horrible.
Mexico is the 4th most popular country in the world for cosmetic surgery.
And to just ask a plastic surgeon if they're board certified is not the only question. You got to ask him the next question. By what board?
Mexico has its own board, the Mexican Association of Plastic, Aesthetic, and Reconstructive Surgery, which has an online database where you can search a doctor's name.
They have a picture of the OR.
We showed Dr. Robles the website for Clínica Hospital del Sol. It's the same clinic where a 25-year-old Phoenix woman lost her life.
But, you know, it doesn't look to me like it's a hospital. It looks like to me it's like in a district where they just have storefronts.
Also alarming, an actual doctor's bio, which is nowhere to be found.
So there's nothing here that tells me anything of who performs the surgery.
And there's no typical before and after photos with satisfied patients.
They're pretty much playing Russian roulette with the patient's life.
Well, Dr. Robles says it takes a lot of work and time to become a board-certified plastic surgeon. Once you are, it's not something you're going to hide, so it should be fairly easy to find. In the Live Alert Center, I'm Monica Garcia. Back to you guys. All right.